flash back to the year 2000. At that Open, Tiger won his first claret jug at the Old Course. It was his fourth major overall, and with the win, became the fifth golfer in history to complete the career Grand Slam. Tiger followed that victory up in 2005 with his second win in the Open and another win at St. Andrews. Woods led wire to wire for his 10th major title overall. On Saturday, however, some unfortunate news for Tiger, who announced on social media that he underwent yet another back surgery, his 7th overall on his back and second in just over a year. This time to replace a disc in his lower back that had caused pain and mobility issues. Tiger says he had the successful surgery in New York on Friday and added that it was a right decision for his health. Tiger did not, however, give any timetable on his return to golf. Pleasure now to welcome in Dr. John Torres, senior medical correspondent for NBC News. Doctor, can you explain to us what this type of surgery seeks to accomplish that Tiger just underwent? What is the recovery time and what impact does it have on other parts of his back?
So the main thing this surgery wants to do is try and alleviate any pain he has in his back. And you can imagine, especially Tiger Woods, with the amount of force he puts in his lower back when he's doing a golf drive, that can create a lot of pressure down there, a lot of wear and tear over the years, which can then result in pain. And here's essentially what happens. You have these vertebrae, which are the bones in your back. Down in your lower back, you have 5, which means you have 4 discs in between the vertebrae that act as a cushion. That cushion makes sure that as it's compressing, as it's turning, it alleviates any pain that might occur in there. But over time, that can wear down, and that can make sure that he has pain because then he gets bone on bone. What they do is they remove that disc, they put in an artificial disc, and that lets it essentially alleviate some of that pain. Not necessarily all of it, but at least some of it. But it is a surgical procedure. Tiger Woods has had other surgical procedures, and it's one of those things that in a typical person, average, they usually end up going back to work in 4 to 6 weeks. They end up being able to get back to their regular activities, including exercise, in about 3 to 4 months. But a couple of factors here. One, his age. He's getting close to 50. Number 2, the amount of pain and issues he's had in his back before, and the amount of wear and tear he puts on his back generally, all mean that it's probably going to take him a lot longer, and we're not even sure he can get back to that regular stage he was at before the surgery.
That's interesting because he had a second back surgery just over a year ago, and I'm curious if that surgery is an indication that it's directly related to this one, given overall wear and tear on the spine.
And I think you have to say it is because he's had these back surgeries. This is his 7th one. And in golf, especially as vigorously as he ends up driving a ball, that puts a lot of pressure on the back. The more surgeries you have, the more you throw off what are called your biomechanics, meaning that even just little micro adjustments in your back because of surgery, because of scar tissue buildup, because of a little change in anatomy, can create other issues in other vertebrae and other areas of the body. And so you can imagine with each surgery, he gets progressively smaller and smaller changes in his biomechanics, but over time, those end up putting pressure on other areas, like in this case, that L4-5 vertebrae we're talking about, and that can cause issues there. So the more surgeries you get, the more you throw off those biomechanics, the more you throw off those biomechanics, the more you cause issues in other areas. And so I think you do have to say these are all related.
A little bit of a domino effect then. Doctor, you've already alluded to the following question, but I want to ask you straight up. Given the amount of trauma from the types and frequencies of surgeries that he's had on his back, do you foresee Tiger ever recovering enough to compete at the level that he did even recently?
You know, if you're talking about an average person, I would say no, they're probably not going to get to that point. But we're talking Tiger Woods, who is at the top of being fit, the top of an athlete's abilities. And so I think a couple factors in his favor. Number one, he's extremely fit. He's been playing golf for a very long time and has mastered his golf. And his body is able to recover from these surgeries he's had in the past. Unfortunately, going against him, his age, the multiple surgeries, and the issues he's had, the ongoing issues he's had, we talked about with the biomechanics and other factors that are going to cause him to slow down a little bit in this area. So I think if you have to look at it overall, and more than likely he's going to get back to some stage. It's probably not going to get back to the stage he was a year, 2, 3 years ago. But again, age is catching up to him. Surgeries are catching up to him. He has a lot of factors going against him, but it is Tiger Woods we're talking about.
Very true, Doctor. Thank you very much for that. We will keep a very close eye on it, and we appreciate your time.